This is the situation a few months after implant insertion. The implants are osseointegrated and the soft tissue is healed well around the healing caps. I seat the specific hex head extractor into the hex on the head of the healing caps, place a finger on it and rotate it to unlock the healing cap. Sometimes the cap comes out in this way. Sometimes, because of soft tissue adherence, we have to use tweezers to remove the cap from the implant. We seat the hex head extractor on the second cap, place a finger on it to stabilize the instrument, and rotate to unlock the cap. This is the abutment I've chosen for this case. We rinse and dry the inside of the implant, insert the abutment, rotate to find the hex engagement, and exert a light finger pressure on the abutment. We do the same with the second abutment. Rinse, dry, rotate to find the hex, and push the abutment down. Now we have to activate the Morse taper connection between the implant and abutment. To do so, we can use a specific abutment beater or a rod like this and a mallet. A few percussions are enough, and the abutments are connected. We mount this specific cross-cut burr on a turbine. First of all, we reduce the posterior abutment height. At a certain point, you should stop and try and remove the piece that is being separated from the abutment. Then the surface has to be smoothed. After I shorten the anterior abutment for about 1 millimeter, at this point the height of both abutments is fine. Now we have to shape the abutment until we obtain 2 parallel abutments. Rough shaping of an abutment, especially in height, can also be done out of the mouth before connecting the abutment to the implant. When preparing an abutment extraorally, you should hold and protect the abutment with a specific handle. As the implants are already perfectly osseointegrated and the soft tissue is conditioned well and mature, we can also finish the preparation of the abutments. To finish the abutment preparation simply means to arrive in this area with a chamfer margin design. Then we have to take an impression, exactly as we do on natural abutment teeth, and the technician fabricates a definitive crowns that finish exactly here. For intraoral abutment preparation, we use cross-cut tungsten carbide burrs and coarse-cut diamond burrs with a slightly conical chamfer tip. Always use copious irrigation when preparing an abutment intraorally.